All right, good afternoon, everyone. Thank you again for joining us. My name is Ani Jean-Pierre. I'm the Senior Policy Director for Children's Alliance, and thanks for joining us for this afternoon's event, Advocacy and Action. We're excited to be with you this afternoon and highlight some of the bills and budget priorities that we're focusing on as we enter into the second half of the 2024 legislative session. We have a great panel of speakers today, including our Executive Director, Stefan Blanford, who will give a little bit of an intro about Children's Alliance and Have a Heart for Kids Day, which is our lobbying event this next week. And then we also have our Economic and Health Policy Manager, Max Lau, who will talk about our health and economic justice policy priorities. We have Emily Mickelson to talk about our early learning priorities, and we have our lobbyist, Devin Connor Green. So attendees will be muted during the presentation, but we do have the Q&A function enabled, and so you'll be able to submit questions through the chat as well. And we do have technical support from Alicia and Dan on our team, so thank you to them. Dan will be monitoring the chat and the Q&A and will moderate our Q&A. And we are recording the event, so if there's anything you'd like to see again, we'll be sending out a recording as well. So just another recap about our agenda. Stefan is going to talk a little bit about Children's Alliance and Have a Heart for Kids Day. And then Devin is going to cover some context, talking about our legislative session, where we are in the process, and some updates about status of bills. And then Max and Emily are going to cover our policy priorities in terms of early learning and childcare, health equity, and economic justice. And then we will have time for Q&A at the end. So again, feel free to submit whatever questions you may have through the Q&A function or through our chat. And with that, I will pass it over to Stefan.
Thank you, Ani. And thanks to everybody for being a part of our Have a Heart for Kids Day event. We're really excited about it, partially because most of us haven't experienced a Have a Heart for Kids Day event in person. We have not had an in-person event since the pandemic, so we are thrilled to do something in person where we can really rally our folks, our 7,000 members from across the state, to advocate fearlessly for the interest of children. For those of you that don't know Children's Alliance, we are Washington State's nonpartisan advocacy organization that advocates for children. We just celebrated our 40th anniversary last year. So we've been around for a while and been fiercely advocating for children. Our mission is to strive to place racial justice at the heart of Washington's laws and budget priorities so that every child in the state can thrive. All 1.7 million children in our state, everyone can thrive. And then our vision is that all of Washington's children will have an abundance of what they need to grow up to be the people that they dream of becoming. And a big portion of that is that fierce advocacy around racial and equity justice, with the recognition that there are lots of Black and brown children all over the state in urban environments and rural environments that are way behind in terms of their chances to realize their lives. And so we're doing all that we can to make sure that that is the case. Next slide. And so as I indicated, one of our key values beyond the racial focus on racial equity is that we advocate with community and not for community. And what that means is that we try wherever we can to empower those who are going to be most affected by the policies that we promote to be spokespeople for those priorities, both in creating them and then in advocating in Olympia. And so Have a Heart for Kids Day is all about that. It is the opportunity to rally as many people as we can to share why the priorities that communities have told us are important, to meet with legislators and do on a one-on-one basis, sharing with those legislators why these priorities are important. In the past, we've done this work with our communities, but in this year, we've decided to partner with a number of well-aligned organizations to all advocate on behalf of children. They include the Washington State Association of Head Start and ECAP, Save the Children Action Network, Washington Family Engagement, Families of Color Seattle, and Social Venture Partners. And we're all working together on the issues that matter for children and intend to rally on the Capitol steps at some point to make our voices heard. Next slide. And so the elements of the day for Have a Heart for Kids Day will all meet somewhere between 8 and like 10 o'clock in the morning and go through Advocacy 101 trainings that start at 8 o'clock, at 9 o'clock, and then at 10. And then after that, individuals who come down to Olympia will get the opportunity to meet with their legislators, the people who represent them, and discuss the issues and priorities that matter. And then we'll have a rally on the Capitol steps starting at 2:30. And there's both an in-person and a hybrid option for folks who are able to make it down there and those who have to remain in their homes or businesses. The registration for this event closes on February 12th. So if you have not registered or your friends have not registered, please encourage them to do so. And then the hybrid registration closes on Valentine's Day on the 14th. So if you haven't done that, please make sure that you are registered so we have a good count and can follow through on all the great activities that we have. And so with that, I'm going to toss to our the person that I refer to as the point of the spear, the person who does advocacy directly with legislators on our behalf, and that's Devin Connor Green, who is our lobbyist. Devin?
Yeah, great. Thanks, Stefan. Good to be here with everybody. So, I mean, let's just get into it. I mean, I think it's been a crazy first month of session. It typically is in the second year of a biennium during a short session, but it seems even a little bit more hectic this year than normal. You know, talking with folks, I think, you know, what I've been hearing is people estimate there have been about as many bills circulating this year as there would be during a long session, and that's not typically the case. So a lot of volume. Obviously, many of those won't pass. But being the second year of the biennium, it's referred to as the supplemental year, and normally policymakers will try to shy away from tackling you know, bigger, more controversial policy issues unless there's some sense of urgency behind them. And when it comes to the budget, they tend to shy away from putting large sums of money into new projects, new initiatives. They're typically looking to supplement projects that have been funded last year and prior years, and look to kind of stretch the money as far as they can go with what they have for this short year. You know, in all of our meetings with budget leaders, and they've really been hammering that home in terms of how tight it is, and you know, on their end, they're looking for ways to get as much done as possible with the wiggle room that they have. Of course, as advocates, we're still pushing for everything, right, and trying to get as much done as we can possibly get done within those constraints. You know, but also taking advantage of the time we're here to educate around and to set up or tee up larger asks that we will all be working on next year, the first year of the next biennium. In terms of where we're at, February 5th was the fiscal committee cutoff. And so as of the 6th, legislators have been on both floors of the chambers, you know, debating and voting on bills. Both chambers rules committees have been meeting very regularly to move bills that have passed those policy committees and fiscal committees out of rules, so that they have a chance to be debated and voted on the floor. This is where it really starts moving at a much quicker pace. So here we are on the 9th, and the House of Origin floor cutoff is coming up on the 13th, which I believe is Tuesday. So a lot of volume in there in terms of bills, as I mentioned earlier. It's where a lot of bills will die. Of course, you know, you can always come back next year and start the process over again. And it's not always a bad thing for your bill to die. You know, a lot of these things take many years to pass, and you know, moving your bill part of the way through the process in any you know, 2-year cycle is a great way to educate people and socialize the issue as you build support slowly as you try to get it ultimately passed. So the 13th is the next cutoff. At that point, it starts moving even quicker, right? So bills will cross over, and then that opposite policy cutoff will be February 21st. then just would be even quicker at that point, right? So the opposite fiscal committee cutoff will be the 26th, only 5 days. And then March 1st will be the floor cutoff, only 4 days. And then there are weekends mixed into that as well. So the last day of session is March 7th. Quick update in terms of what has happened last night in the early learning space. A vast majority of the bills that were in rules, made it to the floor and were voted through. Another good handful were moved out of rules so that they can be voted for on the floor. So a lot of progress there just over the last 24 hours.
Hi, everyone. My name is Emily Mickelson. I'm the Early Learning Policy and Coalition Manager at Children's Alliance, and I am excited to talk with you a little bit about some of our early learning bills and opportunities for advocacy this session. So we have 3 topics that I want to talk to you about in the early learning space today. First is Holding Hope, which is a program that offers infant and early childhood mental health consultations across Washington State in partnership with childcare providers. Second, early support for infants and toddlers, which helps to ensure that funding allocations account for critical work that is done in the first month of a child's early intervention services. And finally, I want to talk about a bill seeking to prevent trauma for children in schools by phasing out the practice of isolating elementary school children in nearly all instances and limiting restraint of students. Please feel free to put any questions in the chat as we go along. I'll do my best to answer them either here or during our Q&A following the presentation. Next slide. So our first slide here is going to be about Holding Hope. Holding Hope is currently in a budgetary process, and so hopefully we will have an update for you as we near our Have a Heart for Kids Advocacy Day. But I do want to provide you details as they exist in our current budget request that is moving now. So as an overview and kind of a background, the American Academy of Pediatrics estimates that approximately 16% of children under the age of 6 experience mental health concerns that are significant enough to warrant clinical intervention. Particularly following COVID-19, we are seeing significant shortages for mental health services, and these problems tend to be disproportionately experienced by families that are already furthest from opportunity. Holding Hope is an existing program that has 15 professionals across the state who are doing critical work to help families and childcare providers by creating a collaborative and supportive team. By partnering with childcare providers, Holding Hope is able to provide mental health support that is specific to young children's development without creating a bifurcation between mental health and early learning. Rather than existing in silos, Holding Hope brings these two together along with parents to be part of conversations that need to be nuanced and individualized to a child. You'll probably find that that theme really runs throughout our early learning discussion today. Mental health consultations are important in early learning for a couple of reasons. First, social emotional health, these early relationships that children are developing, are the building blocks of a child's lifelong mental health. And so making sure that we are addressing early challenges is critical to ensuring that as a child grows up, they grow up with healthy development as well. Second, when children experience social emotional challenges in early childhood, they often respond in ways that are very specific to their development. So young children are often not yet able to vocalize how they are feeling or explain why they are feeling that way. And as a result, they act in ways that are appropriate for their development. Unfortunately, these behavioral responses may be interpreted as intentional or defiant. And it is not uncommon for children in early learning to experience exclusionary discipline. In fact, we find that preschool and pre-K are relatively prevalent spaces for exclusionary discipline. Exclusionary discipline can happen when a caregiver is asked to pick a child up early from childcare, or if a child is asked to be removed from their educational program entirely. Sometimes this is couched in language like the program simply doesn't have the resources needed to support a child. In either case, a child is removed from their first experience with an educational space. And this is harmful not only for the social emotional health that they've already been building, but for their understanding of sense of belonging in their community and in the educational spaces moving forward. As a result, it is critical to remember that young children's behavior is always a form of communication, and we want to make sure that children are met with support, not discipline. So as a result, we are requesting and supporting a $1.75 million expansion as an additional investment to improve access to infant and early childhood mental health consultation. That's the Holding Hope program that we've been discussing. The program currently only has a capacity to serve about 2% of eligible programs. And so while it is doing fantastic work, we do know that there's a wait list of over 100 eligible programs. Next slide, please. The second program that we want to talk about, and this is actually in the form of House Bill 1916, is early support for infants and toddlers regarding count funding. This is a technical bill, but actually has a really important impact. So House Bill 1916 adjusts the way that early support services are counted to ensure that providers are compensated for crucial work in the first month when a child is referred. To make that a little bit less technical, when a child is referred to early intervention services, there is a long and really important process that plays out that helps to identify where a child has strengths that we can build on, and where a child needs additional support. Like an older child's individualized education program or an IEP, this is highly individualized and specified to a child. It is developed ideally, not only with professionals around the child, but also with a child's existing support network, for example, their family, to help understand how this can be comprehensive in most ways. Early support for infants and toddlers provides early intervention for kids even before they enter pre-K or kindergarten, which means that we can start creating a solid foundation before they enter school. And it's important to help kids be identified for support services as early as possible, because many of these early milestones are foundational, meaning that future development skills really do rely on those processes. In fact, this process is so important that the federal government instituted Child Find, and the Child Find program is used in Washington to help identify children as young as very young infants, so from birth and up, who need additional support. Like I mentioned, early intervention is fairly similar to IEPs for older children. In addition to being individualized and tailored to a child's needs, it also looks for measurable and specific goals to help ensure that a child's healthy development allows them to become the person they dream of becoming. This bill recognizes efforts involved in intensive evaluations and individualized service design. When providers are doing a lot of this upfront work, we want to make sure that along with this bill, we are helping to ensure that children and providers alike have access to the funding and corresponding services that they need to help children thrive from an early age. Next slide, please. And finally, I want to talk about student restraint and isolation. This bill phases out isolation for elementary students in most instances, and it limits instances where restraint may be used, which is denounced as trauma-inducing within advocacy circles. This is incredibly important because in Washington, children with disabilities represent over 90% of children who are either isolated or restrained in educational spaces, despite making up only 15% of the student population. We, of course, care about all children who are experiencing trauma in educational settings. But I do want to also take a moment to highlight that this is also important specifically in our early learning cohort, as the bill highlights pre-K as one of the populations that it's considering. Additionally, we understand that these practices are disproportionately experienced by children of color, especially Black boys, and children who are experiencing foster care. When we are looking at isolation and restraint in school systems, we often hear it discussed as a tool that is used in a classroom, one that is not enjoyable or wanting to be used, but one that teachers feel would be detrimental to be taken away. However, when we look at the research, we also find that it is actually not beneficial for either the student, who is often traumatized by these practices, or in order to get the results or the behavioral outcomes that the policy theoretically would help to foster. There are more trauma-informed and research evidence ways that we can help support students. House Bill 1479 creates new avenues for parents to be promptly informed of any instances involving isolation or restraint for their child. And that is incredibly important because it means that they can be prompt and effective in advocating for their child. This is critical because many students who experience isolation or restraint may not share their experience with parents or guardians, or at least not right away. The bill is also important because it implements systemic data collection, and that's needed for implementation enforcement. It does this through disaggregated data collection and analysis, which shows both geographic distribution and how experiences differ across student subgroups. It is worth noting that isolation and restraint are already discouraged as a regular practice in education policy across Washington. Again, this is not something that most teachers want to use. In fact, there is a push to find better practices that support students rather than punish them. One of the challenges, though, in supporting equitable implementation is related to this reliable data collection and accountability involving parents. Just as parents can only take action to advocate for their child if they are aware that their child is being isolated or restrained, policy can only react and be effective where data helps us to accurately understand the situation. In short, this bill represents a critical step for equity for children with disabilities, children of color, and children experiencing foster care or other exclusionary discipline. And with that, that concludes my portion of the presentation, and I am excited to pass it over to Max.
Hey everybody, my name is Max Lau. I'm the Health and Economic Policy Manager. I'm going to talk to you about a couple of bills. I wish I could say that the health and economic bills were as successful as a lot of the early learning bills, but unfortunately that is not true. But I will get into kind of towards the end of my section here why that's not necessarily a bad thing, and how we can keep momentum going for future legislative sessions. Next slide, please. So within the scope of our health-focused bills, I'm going to talk primarily about this one bill, HB 1946, that would modify some of the language around the Washington Health Corps' financial assistance for certain professions program. Some of those programs have loan repayment services. Some of them, or some of the professions in that program have loan repayment services, and some of them have conditional scholarships as well. And this bill would be adding behavioral health practitioners to that list of professions who would qualify for these conditional scholarships. The aim behind this bill is primarily to tackle the provider shortage that many people are facing. I don't think I really need to reiterate it super strongly for anybody here, but there's clearly a behavioral health crisis in our state, especially when you look into how it's particularly affecting children. And youth coming out of the pandemic, like Emily had mentioned. There are seemingly insurmountable behavioral health issues that a lot of people are facing, a lot of school districts are struggling to address. And part of the issue is that there's just a shortage of providers available. And so this bill tries to address that by making the process by which you would become a provider a little bit easier and to remove some of those barriers, especially financial ones. I can speak to personal experience, having gone through all of the educational requirements to become a mental health practitioner, that it is incredibly expensive. And because of that, you tend to see some relative homogeneity amongst people going down that educational path because it's so expensive. It excludes a lot of people, historically under-resourced and underserved communities. I can speak to my program specifically. It was almost exclusively white people. And we know that in a behavioral health setting that your response to treatment and to clinical behavioral health services improves when you're able to see a provider who looks like you, who identifies similarly to you. So the fact that so many people are facing these barriers to becoming providers is not just an issue of not having enough providers, but it's an issue of there not being good care for everybody in the state. So to talk a little bit about what this bill does, if we can go to the next slide. The super short answer, it's actually a relatively small bill. It essentially ticks a box on a list of professions that would be eligible for these conditional scholarships. The conditional nature of the scholarship means that people who receive it would have to commit to serving certain underserved communities. The program that runs this determines those communities, looking specifically at what communities have provider shortage issues. And it's intentionally a little bit vague so that it can incorporate as many people as possible. But the short answer is that there are a lot of communities that don't have behavioral health providers. And so people receiving this scholarship would have to commit to serving those communities. Broadly speaking, it would make behavioral healthcare very accessible because there would be more providers and there would be more diverse providers. And it would address kind of these, what I'm calling care deserts, areas that don't have any behavioral health providers, especially rural communities who just have, there's just not enough people out there. We see all these school districts that have severe behavioral health issues that they're trying to address, but you have school counselors who have hundreds of students that they're responsible for, which is just an impossible caseload for one person. So that's kind of the core of this bill. More providers means more access to care. More providers means the care will be more affordable, and a more diverse population of behavioral health care providers would mean that the care itself is likely more effective for people across the state. This bill, like many of the bills that I'm going to talk about, or many of the bills that we were working on and we were tracking, but unfortunately have not made it past the fiscal cutoff, does have a significant financial component to it. And so I'm going to talk a little bit soon about why that makes a lot of these bills so difficult and why it makes some other bills so important. So if we could go to the next slide, please. So I'm going to talk about the wealth tax, not because this bill is unique in any way, but because it's a really good example of why quote unquote dead bills are not necessarily failures and not failed bills. A super quick summary of the bill itself. The wealth tax people have been fighting for this for years. It is a 1% property tax on financial properties like stocks and bonds, valued at over $250 million. It would only affect about 700 people in the state, and it would raise, I believe, about $3 billion a year, which is a lot of revenue for a lot of really good programs potentially. So if we can skip to the next slide, I'll talk about why this is important. It would be deposited, and this is written into the bill itself, so it would be in statute, that the money from the tax, the $3 billion, would be deposited into a number of trust accounts focusing on education, affordable housing, disability access, and taxpayer justice. The disability and taxpayer accounts are both new accounts. The education and housing accounts already exist. And those get, the funds in those accounts get dispersed into tons of different programs. The education trust account is not specifically for public education. It's also for school construction and childcare and early learning intervention and all this stuff. And so likewise, depositing money into these accounts would open up doors to fund all sorts of new programs. So we only had one bill for the health section of our agenda today because a lot of the other health bills are dead at this point. And we've been talking recently about why we don't want to use the term dead when referring to bills because it's just not an accurate representation of the advocacy process. So we're going to be using the term dormant to refer to bills because they don't necessarily stop once they fail to make it past the fiscal cutoff or the committee cutoff or whatever. That is where this kind of multi-year advocacy approach comes in and maintaining momentum in advocacy. I think next slide has some information about this. So the bill is technically dormant. It'll be a multi-year effort. So what I mean by that is that there are a lot of bills that failed. In our internal tracker, I want to say I had 15 bills in our economic bills that we were tracking. All but one of them are dormant now. And there's similar numbers in the health side of things as well, just because whenever you try and run a new bill, especially in supplemental year, the first question people ask you is going to be, how do you pay for it? I'm sure many of you will want to talk about the free school meals bill that was run this year. It was run last year as well. It'll probably be run next year as well. That bill is enormously expensive, as are many other bills. And so that is why it has faced so many obstacles in passing like a true universal free school meals program, because it's so expensive. And I don't want to say there's not enough money to go around, because there's just not enough money in the state revenue to fund all these programs. And that's because we're not taxing it. There's hundreds of billions of dollars in the state. We're just not taxing it right now. So the messaging I want to really promote as far as all of these bills, dormant bills, is that they are very realistic and we could definitely pass them. It's just a matter of we need to convince the legislature to prioritize raising revenue to fund these programs. So when we talk about the free school meals bill that is quote unquote dead, What we really should really be talking about is that this free school meals bill and providing free school meals to everybody in Washington is not an outrageous idea. It's not unrealistic, and it's certainly not impossible. We just need to raise the money for it, and we totally can. So things like the wealth tax, things like real estate excise tax, things like the capital gains tax, which is in the news a lot right now, are all avenues by which we could raise funding and raise revenue to pay for all these programs, to pay for the conditional scholarships, to pay for free school meals, all of these programs that I think we can all agree are totally worthwhile. And a lot of legislators would probably also agree with you are great programs and totally worth it. We just don't have money to pay for it. So that's what I want to make very clear. Maintaining momentum and bringing them up over and over again is really the key to this. It's going to be a multi-year approach. Children's Alliance was very heavily involved in passing a dental therapy bill last year. That bill, I believe, took 13 years to get passed finally. I'm crossing my fingers that we don't see that same timeline for a lot of the bills we're passing now, but that just may be the reality of the situation. You have to maintain momentum and you have to keep bringing it up. So, in conjunction with a lot of the messaging requests around people pushing for progressive revenue and economic justice, when you talk about a program that you feel passionate about, whether it's free school meals or behavioral health services or early learning interventions or the Holding Hope consultants or whatever it is, that you also bring up that these are not, asking, well, how do we pay for it or it's too expensive. It's not a real issue. It's only an issue because we allow it to be an issue. And that's because we don't raise money and we don't tax wealth. So things like the wealth tax, capital gains tax, totally realistic and very simple to implement into these programs. The money is there, we just need to raise it. And then we could afford to provide all these services and they're totally realistic. I think that's my last slide, so I might pass it back to Ani, I believe.
All right, thank you, Max and Emily and Devin and Stefan for those really helpful insights about Have a Heart for Kids Day and their policy priorities as we go into the second half of the legislative session. Next slide, please. So we want to thank y'all for attending today. At this time, we would love to take some time to answer any questions you may have about the topics we've discussed. If you have any questions specifically about Have a Heart for Kids Day or the policies that we're working on, please feel free to submit those through the Q&A or through the chat. I do want to point out just a quick clarification about the hybrid and virtual and in-person registration for Have a Heart for Kids Day. So you can attend Have a Heart for Kids Day virtually in a hybrid form where you may attend the trainings in the morning virtually and then the rally in the afternoon in person, and you can attend fully in person. If you are attending any portion of Have a Heart for Kids Day in person, your registration needs to be submitted and received by the 12th, Monday, the 12th of February. If you're attending just virtually, that's when the registration closes on the 14th. So I just wanted to clarify that. I'm also going to put the information in the chat, and feel free to reach out if you have any questions about that as well. So
we have a question here from Hannah. Will GBI, Guaranteed Basic Income, be included as a priority in future legislative sessions?
I can speak to that a little bit. The short answer is yes. Children's Alliance, at least our organization, is super excited about the GBI. And a lot of legislators are, and we were actually able to get a public hearing this year, even though unfortunately, but realistically, there was pretty much no chance of it passing this year because it's so expensive. But the GBI could certainly fall kind of in that purview of taxpayer justice or economic benefits that would be funded by the wealth tax, which currently would fund things like the working family tax credit, the earned income tax credit, or TANF, or earned child tax credit, whatever it is, right? There's all these tax credits and financial economic incentives and programs and assistance programs that are funded by the wealth tax. I don't know if GBI is a really high fiscal note. I believe the pilot program, which would target 7,500 people, is like $250 million. I could be getting that number totally wrong, but it was massive. So that would definitely need significant revenue changes. I don't know specifics around if they're going to be trying to change the program or to pass any amendments right now, but it is definitely going to be run again next year as a high priority item. I'm meeting with some of the GBI people later to talk about that specifically. So definitely bring that up. GBI and direct cash benefits are so easy to connect to so many other issues around education or behavioral health, especially. So short answer is yes.
Right. We have another question from Kathy. Could we get a repeat of the bill numbers for the early learning bills?
Absolutely. So I added them in the chat just so there is a written record in case anybody would like them. The Early Support for Infant and Toddlers program count is House Bill 1916. That currently has a second hearing on the House floor coming up. And then limiting isolation and restraint for students is House Bill 1947. That did pass the initial cutoff on February 5th, but it has not yet been pulled down to the floor for a second hearing. Holding Hope is actually a budgetary request, so it does not have a specific bill attached to it, but it is still moving through its own legislative process. And if there are any follow-up questions, I'm happy to address those as well.
We have a question from Cheryl. How will Washington kids be impacted if the CCA is reversed and the almost $1 billion in state revenue is lost? That's the I'm not sure what CCA stands for. I think Emily can help me on that.
Yeah, so that's a major question that we're kind of working through right now. Our understanding is that we are not at particular risk of losing the revenue that has already been collected. The question is whether funds can be accumulated moving forward. But we are certainly looking at, and a lot of the reason that we're concerned about things like the wealth tax is making sure that we do have consistent revenue streams as well. And Devin, I might tap you here as well if you have anything that you want to add on that front.
Yeah, we're talking about the ballot initiative, right?
Yeah.
Yeah, I haven't heard what the legislature will do with that. My assumption is they will kick it back to the people for a vote, but there hasn't really been any discussion that I'm aware of as to what they'll exactly do. But yes, that's all we know so far.
All right, well, thank you, everyone. If there aren't any more questions, then we can end it here. Thank you so much for joining us this afternoon. We appreciate your support and interest, and we look forward to seeing you on the 15th for Have a Heart for Kids Day. Take care.